Good morning. We are going to set the calendar for Friday, tomorrow. And I had told you yesterday that I had hoped that we would be able to set the calendar also for Tuesday, but we do not have enough bills to do that. But I am informed that there were probably 10 plus bills that came out of committee yesterday. They're going to be an equal amount or more that are going to come out of committee today. So what we're going to do is on Tuesday when we meet here at 9 o'clock, we will set the calendar for Tuesday and for Wednesday. And so we'll do that then, but you still do not have to come back tomorrow for rules, and you don't have to come back on Monday for rules. So with that, I don't see anybody on the wall, so we're looking at members. Chairman Cooper.
Thank you, Mr. Chairman. I'd like to ask for House Bill 63. This is the bill that passed out of the House, and I think it was actually a unanimous vote, and went over to the Senate last year and got left on the floor. And what it does is it's a step when insurances have a step therapy plan, which most of them do. It gives patients in the appeals process to get medicines that they need, their doctors say they need for serious illness, and they need to get them without having to be filled twice on some other drug or because it's contraindicated and will cause problems, that they have that as their standing in an appeals process.
Okay, this is HB 63 under modified structure. Any questions? I don't see any. Okay, Chairman Alan Powell.
Thank you, Mr. Chairman. I'd like to ask for HB 192. This deals with the Georgia Realty and Appraisers Board. Since the 1990s, the federal government's had oversight about how the appraisal board licensees and how that the state agency regulates appraisers, and this is in regard to doing appraisals for loans. When the collapse hit a few years ago, it was the federal government started systematically every year creating new rules and regs that the appraisers board has to go by, and this bill brings us into compliance. Third year we've been doing this, and the feds keep changing all of the rules and the regs about how to deal with the appraisers. The AMCs, the appraisal management companies, are the go-between between licensed Georgia appraisers and how they do these type of appraisals for loans. This simply puts everything in line so that the Georgia Real Estate and Appraisal Board can continue to regulate these. If not, these appraisers have to go straight to the federal government, and we don't want that because that'll be a sure enough cluster.
Are there questions? No questions. Since we now have somebody on the wall, Chairman Silcox.
Thank you, Mr. Chairman. I have two bills for you all this morning, and one of them is House Bill 166, which is the Genetic Counselors Act, and that is really a bill. It's a bill that we had last year for the licensure of genetic counselors, and this bill is really needed because we have a lot of people running around that are not qualified to give out this type of information. And these folks are required to, of course, have master's degrees or PhDs, specifically in genetic counseling. There are approximately 89 genetic counselors in Georgia. Half of these are hospital-based, and doctors refer appropriately to them. The other half are out in the field, actually educating physicians, because many physicians had genetics, of course, in medical school, but genetics has advanced so much, and we've learned so much more about the human genome since they were in medical school that they're actually out teaching doctors how to appropriately refer to them. They work primarily in three areas of healthcare: prenatal care for complicated pregnancies, oncology care for cancer history, as well as cardiac care. They, of course, the GORC program, or the GORC Commission, reviewed their application and approved it in July of 2017. So we're now almost 2 years later, and would appreciate your favorable consideration on this bill.
Are there questions? Chairman Setzler.
Thank you, Mr. Chairman. Forgive my voice, is struggling today.
I'm so sorry.
Chairman Silcox, what is this, in setting this up, what is it, is there any restrictions on physicians who have normal conversations about genetic-related things with their patients?
No.
How does, what does this specifically allow accredited counselors and therapists to do, as opposed to a physician in their normal course of serving their patients?
This doesn't interrupt the physicians at all, Mr. Chairman. This really is just an adjunct to their education to help them, like I said, to better refer their patients appropriately if the situation presents itself when they have a health situation. But it really doesn't interfere with their work at all.
So there's no circumstance in which only a genetic counselor could do certain things?
No.
It just becomes sort of a heightened specialty that we're recognizing?
Mm-hmm.
Thank you.
Thank you.
Any other questions? You have no other questions?
Thank you. If not, I'll move on to House Bill 128. And House Bill 128 is about high-low agreements. And high-low agreements come into play when you have a medical malpractice case and there's a physician or a dentist that is sued. And many times these cases may or may not go to a jury, and so the parties may agree before the jury comes back to a high-low agreement. If the jury comes back with a verdict for the plaintiff, then the high amount will be paid out. If the jury comes back with a verdict for the defendant, then the low amount is paid out. In the past, regardless whether the doctor was found negligent or not, this results of these lawsuits had to be reported to the Georgia Medical Composite Board. But with this change in the law, if it's approved by you, the physicians would no longer have to report the low agreements. This is really burdensome and awkward for the physicians to go through these very difficult trials for them and then have to report a low amount even though they were not found negligent. So I think from a public policy standpoint, the general public is protected because, again, this would still be reported if the doctors are found negligent and the high amount is paid out.
Representative Williamson.
Thank you, Chairman Silcox. You did a good job in committee yesterday.
Thank you.
I just want to clarify, when it comes to the not guilty verdict, if you will, the defendant's found in his favor, his or her favor, that's not public at that point about any kind of high-low agreement, is
That's
it? It's
correct.
just between
It's
them.
just
It's a
between the
contractual
parties.
agreement between
Absolutely.
them, the plaintiff's attorney, and the insurance company's party to that
That's correct.
contract as well. So thank you. It's a good bill.
Thank you.
Mr. Bodie.
No, Mr. Welp, no. Of course.
Any other questions? Chairman Fleming.
Thank you, Mr. Chairman. Chairman Silcox, if I understand the bill, and I appreciate you having a chance to talk with me about it, we in the law for a long time have encouraged parties to resolve their disputes before they get to the courtroom. We even try to get them to resolve their disputes while they're in the courtroom. It's always better for the parties to come to an agreement rather than being told what is going to be done, in my experience, and I think most attorneys agree with that. And all your bill does, as I understand it, basically, is that when the parties come to somewhat of an agreement, in other words, either one side's going to get this much or that much, we call it a high-low agreement. When the jury does come back saying the doctor didn't do anything wrong, under the current law, if they have one of those high-low agreements where they're going to pay something no matter what, they have to be reported as if the jury found them negligent. Is that correct? And this will prevent that from happening. Is that right?
That's correct.
Okay, thank you.
Thank you.
You have no more questions. While you're here,
Yes, sir.
why don't you tell us about HB 158, the HIV?
Yes, this is a bill that would ask the ADAP formulary as well as the Medicaid formulary to be the same, because there are instances where people lose their eligibility on one program or another due to changes in their income and what have you. And this would ask those programs to be the same because HIV is such a serious disease. And it also stipulates that they would, if they are a new patient, or that they would take a single tablet regimen as opposed to a multi-tablet regimen, because compliance is really the very most important thing in terms of HIV. If someone doesn't take their medications every single day, then they are not virally suppressed and they can spread the disease. The approximate cost of this is fiscally responsible in the way that it would cost the state approximately $338,000 per person to take care of them over their average lifespan with HIV. But the cost of not treating one of these individuals because of their potential for spreading the disease is approximately $1.79 million. So I think this is a very humane thing to do, number one, but it's also a fiscally responsible thing to do. We are the #1 state in the union for the outbreak of HIV. We had approximately 1,513 cases outbreak in 2016. Those are the latest statistics.
Thank you. Are there questions? You have no questions. Thank you.
Thank you.
Chairman Dempsey.
Thank you, Mr. Chairman. I bring before you two bills that made it through the House well last year but struggled on the final votes. The first, and both are dealing with weight management and obesity. The first is HB 160 to reinstate a 4-year pilot program to provide coverage for bariatric surgical procedures for the treatment and management of weight loss. It has rigor. It is, the burden was very strong, I think, in the 2-year pilot that was held previously, and this will be in the state health benefit plan to allow our employees, teachers, school workers, and retired members to be able to be healthier and cost us way less.
All right, I have a question.
Yes.
If we have done a pilot before, my understanding of pilots is that you do a pilot to determine whether it makes sense or not. If we've already done a pilot, why are you proposing to do another pilot?
It was not in place for the last 2 years, but when the pilot did, there are empirical results, and I applaud DCH for actually the emphasis they put on doing this and doing it well, and it bears proof that we are saving money and saving lives by doing this. They are not ready to put it back into the plan, in essence. At the same time, private insurance, Medicaid, and we're one of, I think, 7 states that do not do this. So it's a continued look to try to prove that this is a good measure.
Are there questions? Chairman Taylor.
Thank you, Mr. Chairman. To the gentle lady, isn't it true that being able to have these surgeries will keep someone from becoming diabetic? And the results really don't show over the longevity of having the surgery. Its long-term results are really what count. Thank you.
Thank you.
No more questions.
The second bill is also dealing with obesity, and it's HB 187 to establish a 3-year pilot also through DCH to look at the results of medication and weight loss management, wellness, counseling. That is another route to helping our employees become healthier and safer. This would be new. This failed in the very last minutes. It traveled with strong support in the House and the Senate, came back over and just did not quite make it out last year.
I'm afraid I'm not going to be able to support your bill. Last year when this came on the floor, somebody told me I had to invoke the Chocus rule.
Okay. We're
Mr.
just trying to
Williams.
help.
Mr. Chairman, quick question really as it relates to both of your bills. Have you got any numbers and this might help the chairman some, how much does it cost us for obesity? You know, have you come up with any figures?
You know what?
Workplace?
Well,
et
as
cetera?
a state, I can tell you right now, obesity costs the state of Georgia $60.6 billion a year. So that's expensive. There's profound savings. There's a little more expense up front, no doubt, for either of these, but other states have done it for their state employees, and private insurance and Medicaid believe in it. So we are a little behind the times of helping our employees and retirees to be healthy.
Chairman Cooper.
Mr. Chairman, I applaud your honesty about using the CHOCUS rule, but I'm afraid if we were all as honest, we probably couldn't garner 91 votes total out of the 180 members to be able to pass the bill.
Any other questions? You have no questions. Is there anyone else? There's no one else on the wall. Is there anyone else on the committee that has a bill on the consideration calendar? Seeing none, we will set the calendar for tomorrow. House Bill 63. It's on. House Bill 128. It's on. House Bill 166. And it's on. That's the calendar for Friday. We are adjourned. See you on Tuesday morning, 9 o'clock.